These discussions really have application to each of our sectors in different ways. Let's think about healthcare, for example. In the healthcare company's balance sheet, they've typically got the old hospital plant, but their delivery model is changing. I'm sure that most healthcare companies are trying to decide what to do with real estate that doesn't serve their needs anymore, but still fund the real estate they need to deliver under their new model.
There's clearly an evolution of the way the healthcare industry and the patient healthcare industry occupies space, from hospital to outpatient to sort of retail-oriented critical care to the medical office building phenomena. You can't be strategically driving the decisions in a healthcare organization
without thinking about real estate.
Without thinking about real estate.
Absolutely, and that doesn't even begin to touch the issues around demographics and the aging population and what we need with seniors housing, especially if that is offered as a part of a healthcare delivery system.
The number of ambulatory visits in those medical office type environments doubled last year. The number of visits to doctors and specialists in general doubled last year. And the question I often get is, how much of that is related to affordable care? Part of it is, it's just an aging population.
That needs more visits.
And that's the demand side. The supply side is just increased specialization in the field of medicine with technological breakthroughs. So that's just an evolution that's not going anywhere, and you have to have real estate as part of the decision-making process.
And Tom, to that point, healthcare would be a industry where the OpCo-PropCo split would be appropriate. Is that correct?
Well, there's a couple different aspects of real estate, and generally we talk about real estate as this monolithic, it's all the same. Different industries have different unique characteristics. For example, some things in healthcare, some of the assisted living facilities and stuff could be operated and restructured directly by themselves. Others, the OpCo-PropCo structure in a net lease type environment might work, and you'd have to think about the different types of physical assets that are in our healthcare companies and what is the most appropriate to their use.
And I would add the repurposing of assets that have become obsolete.